we're excited to have you here again today, Dr. Sivjee, number 3. Dr. Sivjee, just as a brief review, is a respirologist, so he knows a lot about the ballistics of respiratory droplets that happens with the spread of COVID. He is our medical director at Cleveland Clinic Canada and one of our superstars. He was trained in the US at Yale and Cornell. He's a leader in medicine and is one of the corporate medical directors for RBC. And he's a pretty darn good tennis player to boot. So welcome, Dr. Sivjee. And first, how are you doing?
Thank you, Dr. CJ. I'm doing great. As you mentioned, we're back in the clinic, and our inpatient or in-person visits are going up every week, and people are loving seeing each other in person once again after a very long hiatus. But thanks for the invite. I'm really excited I'm not sure I'm excited to be on your 13th podcast with what that number sometimes brings, but I am excited to be here. So thank you.
Yeah, number 13. Sorry about that, but there you go. I did want, before we get into the new normal, we're going to talk about different situations. What is high risk? What is low risk? What are some of the dangers? How do we mitigate the risks associated with COVID? I wanted to briefly bring this up about face masks and asymptomatic spread without getting into any political stuff. I've been upset lately that lots of individuals have been hammered about we were wrong, medicine was wrong, that we said initially about not using face masks. And to be honest, we did follow the science and the information that was available. And we did know that at the time that viruses were not spread asymptomatically. But what is interesting and gives us a little kick and makes us pay attention perhaps a little bit more even, is when someone finds something that doesn't fit and gets ignored. So I just wanted to briefly bring up Dr. Camilla Roth. There's a great article in the New York Times that I posted at the end of this webinar. But interestingly, on January 27th, she got a call as she was heading out for dinner in Munich, Germany. It was a call about a positive patient, a positive test on a businessman she'd seen, and there was no reason for him to be positive. And apparently someone had come over from China, had met with him, was totally asymptomatic, had gone back to China. And she wasn't a virologist. She did infectious disease and she's done a number of areas, but she made the comment in a journal that perhaps there's asymptomatic spread with this virus. And she was slammed. So anyway, I directed you to the article because it was very interesting. But since then, sure enough, she was correct. And we did discover asymptomatic spread, which is why we're now talking about face masks again and making them mandatory, at least here. Perhaps you could address that a little bit and give your comments, Khalil, because I know on our first show, we said, don't wear a face mask. Then we said, which was in keeping with the CDC, the World Health Organization, and so forth. So it was what we were saying. But now in Ontario, it is mandatory. So do you have anything to add to that?
So thank you, Dr. CJ. I'll first start with one of my favorite quotes that you've heard before. It's by Ralph Waldo Emerson. And it's I have to get this right. It's a foolish consistency is the hobgoblin of small minds. That's it. It's a foolish consistency is a hobgoblin of small minds. And what Emerson was basically saying was that you do have to make decisions and make statements based on what you know today. And if what you know tomorrow is different, then you have to make a new statement, even if tomorrow's statement contradicts what you said today. and not doing so is very small-minded. So sticking to one mantra or sticking to one theory in the face of a growing evidence contrary to that doesn't make sense. And I think that asymptomatic spread is an example of that. Now, there are some people that believe there is no such thing as asymptomatic spread. It's actually pre-symptomatic spread. And many people who turn out to be spreaders go on to have symptoms that you can't harbor the virus. It's not a stealth virus kind of just lurking out there, that people will eventually have symptoms. But it also points out another fact, and that is that we're all unique individuals. And some people speak very softly and keep distances away from each other, the personal space. And others speak very loudly and will come up and give you a big hug. And there are risks inherent, especially in these COVID times, of being within 6 feet of lots of people and speaking, singing, all those things that we do in the normal day-to-day activities. So I think it is an interesting article. Interestingly enough, the New England Journal of Medicine picked up on this article as well and published it as a one-off case report, which they hardly ever do. But when they followed that, the Chinese business person who came over to visit the German person, that person was actually went on to have symptoms. So this person was also pre-symptomatic, not necessarily asymptomatic throughout the course of the disease. So I'll leave it at that.
So the article is at the bottom. You'll see it, and I think it gets sent out to everyone that's registered. And I just wanted to give a big shout out to Dr. Camilla Roth from Munich, Germany. So bravo, brava. So one thing, as we resume activities, people have questions on all kinds of these activities. So we're going to go through some of them, and we'll get your comments, and I'll give some comments as well about what's high risk, what's medium risk, low to high risk, and what we can do to mitigate. So for instance, getting a haircut, and I think some of you may have noticed some new improved versions here of Dr. Sivjee. Thank you. No applause. Thank you. So perhaps what kind of risk is there with getting a haircut, and what kinds of things can we do prior to going in for the haircut?
So I think if you looked at that list that you flashed up there before, the pattern here is basically the closer you get and the longer you spend with people, the higher the risk is going to be. And that follows all the science that we know about this, this virus being in respiratory droplets. So, I'm very glad that businesses are being allowed to open, including hair salons. And you do look great in your new do. But I think that one thing we have to keep in mind is that, and I know you're going to talk a little about this later, but we do have to still maintain those precautions that we know are necessary to mitigate spreading of respiratory droplets, and masks being one way to do that. I think complacency is our biggest enemy here. You've seen the pictures of bars in the UK, beaches in California, where people have been allowed to come back to their normal activities, many of which are on that list that you just flashed up. But in addition, the assumption is that they're going to still try to maintain distance, physical distance when they can, and if they can't, wear a mask. And unfortunately, that sort of follow-up strategy and risk mitigation is not being followed. People are really focusing on, oh, okay, it's okay to open up. It must be okay. Everything must be okay, and that's not the case right now.
So a couple of things. One is, in this picture, if you were to pick out what's the incorrect thing, well, she isn't wearing a mask, so that's one thing right off. Another thing, for instance, getting a haircut. call up beforehand, find out what they're doing to mitigate risks. Are they have the chair next to them empty? Are they cleaning in between clients? Are they, wearing a face mask, spacing clients, and just verifying that they're even aware of the things that they should be doing. There was the second thing I was going to mention, and I can't remember. I'll come back to it.
Maybe the spacing between the chairs?
Yeah, spacing is important. So you want to have, the chair in between, obviously, empty. Going to the doctor. Now, you mentioned earlier that we have opened our clinics. I know you've done a fabulous job along with Heather and various people, admin people in the office have done, Dawn Lunan, Heather Sieko, everyone has done a great job on opening up. We have a midtown and a downtown clinic. And we started opening several weeks ago, and we've sort of been gradually adding services and testing and so forth. We also added, as soon as we closed, we started doing virtual medicine. And at least for the first part, for months, we did it for free from 7 a.m. to 7 p.m., 7 days a week, with nurse practitioners and doctors online. So again, bravo to Cleveland Clinic and to you, Khalil, and to the staff. And maybe you could speak to what thought processes you had to go through to mitigate risks for all of us, even going back to work, as well as for the patients coming in. I know it's been a process.
Yeah, no, I think that's really important. And I'll start by saying that, as bad as the virus has been to our health, I think that there are probably two more pandemics on their way that have that are a direct consequence of the virus itself, but have nothing to do with the virus. And that is the chronic health conditions that have been ignored for 3 months. And it's the preventive services, vaccinations, cancer screenings that have been put off and put off and put off. We're hearing statistics already about things like out of hospital cardiac arrests being at all-time highs because people aren't going in for their routine physicals and getting their blood pressure checked and getting their cholesterol checked, and maybe going to an urgent care or emergency room if they have a little bit of weird chest pain because they're afraid of going back in. So I think that one of the major reasons that we decided to open and had to have a plan to reopen was because people need care. We're more than just bodies that are at risk for getting COVID. We're actively living, breathing people that needed all those things that we needed to beforehand. My daughter's tetanus vaccination was out of date. She was due to have it done in March. The minute her pediatrician opened, we took her in and got her tetanus updated, because we got to remember that all those preventive measures are super important. Mm-hmm. And so when it came to our own clinics, we did decide to open and started with all the backlogged important things that needed to be done. So we got all our patients in for their pap smears and their mammograms and their vaccinations, et cetera, et cetera, et cetera. In preparation for that, we followed standard protocols that were laid out by the CDC and the World Health Organization, guiding us on how to reopen. And it's basically screening, cleaning, personal protective equipment that we provided to all of our providers and our patients, and then a way to manage incidents that may come up. And you have to be able to open and you have to be able to pull back if you need to, based on incidents. Knock on wood, we've been open for several weeks and have had no incidents come up. Patients have felt very safe, and caregivers have felt very supported. And I think that culture that you bring to either a business or a doctor's office when you reopen is so important. You build a culture of safety, of collaboration, and of teamwork, that we're all in this together and we're all doing these things for the right reasons.
You know, another pandemic really is around anxiety,
Yeah.
about everything, about, you know, there was anxiety when COVID started, and I've actually done a lot of webinars on mental health and anxiety and parenting and so forth. But now there's a big anxiety about opening and what should we be doing? It's like you've closed down for so many months and you've been so careful, you don't want to blow it, you know? And the other thing I wanted to mention, just to go back, we were talking about face masks, and you know, in different areas, there's a lot of controversy around the face masks, and it's been politicized and so forth. But there are a few people that really do have trouble wearing face masks, and unfortunately, a lot of people have been printing out these cards, I guess, that say they don't have to wear a face mask for medical reasons. But there's not that many reasons that we don't have to wear face masks, at least here. And they're sort of under your umbrella of respiratory things, aren't they? And what would you, which ones of the respiratory types would you suggest probably don't need to wear a mask for their own health and protection?
So I'm going to say categorically none. There are no respiratory conditions where wearing a face mask impairs your pulmonary physiology. And I will tell you that I belong to a group of about 18 community respirologists and academic respirologists. And we've talked about this left, right, and center. In fact, the Ontario Medical Association respiratory section came out with a statement, which was endorsed by the Ontario Lung Association, which said the same. I'll give you an example of a patient that I have been following who has a rare form of interstitial lung disease, who's on the transplant list for a lung transplantation, whose lung functions are about 18% of normal, who wears a mask when she comes into the clinic. And so there's no data that wearing a face covering, either a cloth face covering or a surgical mask, impedes pulmonary function to the point where it becomes medically contraindicated. Now, is it uncomfortable, and is it do people with you know, perhaps some traumatic episodes in their past or other mental health issues that may make it difficult to cover your face? Does that exist? Absolutely, and that's something that has to be taken very, very seriously. And I'm glad you mentioned the mental health consequences of this virus. I think that's going to last well past the virus. You know, even if we're all vaccinated and life is back to whatever the normal is next year, this has been tough on people. It's been tough on their nerves. It's been tough on their families. It's been tough. You know, unfortunately, some people have lost loved ones to this. We're going to see the mental health consequences of this pandemic for years to come.
Well, you taught me something, Dr. Sivjee, today. Because I was reading about, there was in somewhere about cystic fibrosis, and perhaps they didn't have to wear a mask and so forth. But you heard it here today, folks. There's no good excuse not to wear a mask. So thank you for that. So what other things in terms of risk? You know, they talk about getting together with friends. What does that mean? Well, you know, barbecues, wedding, graduations, and so forth. What are your comments about that in terms of mitigating risk?
Yeah, so we are social beasts, and we need for both our mental and, I believe, physical health to interact with others. And so I would certainly encourage people to do so, but I would also encourage them to remember that we can get together and still distance. I had someone who needed to come talk to me about something in my office, and I have my chairs marked out 6 feet apart. We were both wearing masks. We had a wonderful conversation in my office and had no concerns about the risk of that. So, you know, do get together with your friends. Try to maintain distance when you can. Otherwise, wear a mask. And I know there's been talks about bubbling. you know, if you can stick to that, bubbling with a certain number of people, whatever the jurisdiction, the local jurisdiction in your area dictates, and it's not an absolute number. It really depends on what the number of cases are in your area, or what's called the community prevalence. But if you can stick to bubbling, stick to bubbling. But keep in mind all those things that we ought to be doing, like washing our hands before and after, not attending if you don't feel well, trying to maintain your distance while you're there, and having a mask.
Some other things that they talk about is making sure perhaps outside being better than inside eating if you're, you know, like this outdoor picnic. Important things around how food is served, probably family style, not a good idea where everyone's into the same dishes and bowls, and not a good idea to be touching shared surfaces either. So sort of the group kind of thing, probably not a good idea. And also who you're interacting with. I mean, you know, keeping that in mind, the number of people and so forth. What about restaurants? Again, speaking to the, you know, we know that patio is probably better than inside. What other things? I think that a lot of the ideas are the same, really.
Yeah, I agree. You know, I think restaurants and bars have to be separated. Bars are probably one of the higher risks, like off the charts risks, because they're typically indoors. I'm not talking about patios. I'm talking about bars with bar stools where you pull up a bar stool and get served by someone behind a counter. Typically indoors, typically noisy, so you have to be in close proximity with someone to hear what they're saying. And as you know, alcohol does impair your judgment. So you may be more apt to forget about some of the common risk mitigating strategies. So I think the same things apply to restaurants, as you mentioned. Outdoors better than indoor. Hand hygiene. Keep your distance. And if you are within 6 feet of someone like your server, hopefully your server is wearing a mask.
If people have questions, I already have one which we'll address at the end. Just put them in the chat box and Sophie will send them over to me, and we'll get to those shortly. So when we look at travel, Dr. Sivjee, we've spent a lot of time, we're both part of a corporate medical group, and we've been researching information on travel. And you'll see at the end, I've put 2 sites. One is a domestic site that you can click on. So for instance, if I'm going to Nova Scotia, let's just say, where I'm originally from, if I put in Ontario, it will show me when I go to Nova Scotia what the restrictions are and what needs to happen to go to Nova Scotia. And it does that for every province. It also actually, this site that I have at the bottom here has which countries you can go to from Canada currently and what the restrictions are when you get there. So that's really interesting. Plus I have an international site that I found that will be at the end, and that will be sent to everyone that's registered. But we'll see that briefly at the end. And that's a great interactive international site. So hopefully that'll be useful. So Khalil, in terms of traveling, what are some of the dangers of, let's say, air travel, and what things can we do to help mitigate those?
Yeah, so when you think of air travel, you can't just think of the plane. You got to think of every bit of the travel that's involved. So you got to get from your house into a taxi if you're taking a taxi or an Uber to the airport. You got to stand in the check-in line. You got to go through security, where oftentimes they make you take off your mask for identification purposes and domestic safety, I guess, or and then you're getting in the plane. And once in the plane, you know, unless you've got a private jet, unless you're Drake, you're sitting in a in a tin can with a lot of people. And I know much has been made about, well, we'll just skip the middle seat, and that'll make it safer. In my opinion, and it's a debatable point, the middle seat is not the deal maker or deal breaker for air travel. You are going to be exposed in the plane to other people's the air that we're all breathing together. And then there's, of course, the deplaning and the getting your luggage and getting in an Uber or a taxi and getting to your hotel. So it's much more than just the plane. Having said that, again, the risk of transmission is fairly low if you screen. So people that are not well are not getting on planes. You clean, so the environment is cleaned between flights and cleaned well between flights. And you mask to cut down on the respiratory droplets that are being spread. An interesting fact that some of you may know is that the first case of COVID-19 in Canada was at Toronto, and it was a traveler on a flight from China, from mainland China. And that person and his wife both tested positive. They did well. They were fairly young. But not a single person on that flight got the bug, and they were masked. So these two travelers were masked. Presumably, they gave it to each other, or one gave it to another when they were in their home and unmasked, which can happen. But that's just it's an anecdote, but it is a anecdote that shows you that with the proper precautions, and both of them didn't have symptoms, by the way. With the proper precautions, air travel is possible.
And so it comes back to the masks again, of course, and wearing masks. What about other forms of travel? We had a question that I'll bring up now about train travel. What are your thoughts on traveling by train or rail?
Yeah, I think it's much the same. A tin can is a tin can, whether it's a train or a plane. There is something to be said about air exchanges, and I know that air exchanges in a plane are being carefully looked at, and the HEPA filter in a plane is at a certain level where the droplets that are 5 micrometers or less can be filtered out. You'd have to check with each train carrier, to see what their systems are capable of. Do they have the same screening and cleaning precautions? Are they asking their travelers to wear masks or not? And also, what's the ventilation in the train? If you have the option of keeping a window open in the train, which sometimes you do, we know that admixing fresh air with recirculated air also decreases the amount of respiratory droplets in the air.
Just one last point on travel. I mentioned that this site here is good. There's an international site. But if you are in Ontario or Toronto and you are going to a different province, it is very helpful to look at this information and go to the provincial sites. For instance, I am going to Nova Scotia. And en route, there are forms that have to be completed for the New Brunswick border. You can't stop in New Brunswick. You have to keep going. And it dictates the isolation for the different provinces. There's forms as well for Nova Scotia. And I understand at this time, they will call you 3 times during the first 2 weeks to ensure that you are in isolation. I'm perfectly fine with that, doing whatever they need me to do. We do have some questions, Dr. Sivjee, and the first one is, what is the best practice for how to breathe while wearing the mask? I've been talking to patients, so it must be a physician. I've been talking to patients and they tend to mouth breathe versus nose breathe.
So I think that the underlying question there would be, why do masks make you breathe differently? the physiologic concept there is work of breathing and airways resistance. I think that it's important to know that resistance to airflow is what people feel when they can't breathe. It's not that their oxygen levels are low. We've tested that with masks. In fact, there are 7 other things that happen to your body before your oxygen level drops. And so what the brain is really attuned to do is to sense your resistance to airflow. So then you have to ask yourself, what can you do to reduce your resistance to airflow or breathe the most efficiently that you can? And most of you know this answer because you do yoga, right? So the way you get the most air in with the least amount of turbulence is through your nose. You take a deep breath. As long as your nose is not congested or you have allergies and you got all kinds of inflammation. You take a deep breath in through your nose, you blow it out through your pursed lips, mouth, and what that does, ironically, it offers a little bit of resistance as you're blowing out, but it tends to dilate some of the airways so that overall your resistance to flow goes out. And people with things like emphysema and other chronic structural lung diseases will tell you that that's the easiest way to breathe. You take a deep breath in and you blow it out through your pursed lips. If you're ever in line at places like Disney World, if we're ever able to go back to Disney World safely, you'll see people leaning up against railings, pushing down on the railing, taking a deep breath in and blowing out through pursed lips. And what they're doing basically is they're recruiting all the accessory muscles of respiration and giving themselves this back pressure on the airways to dilate the airways and lower resistance to breathing. So you could do that while you're breathing through a mask, but again, it would make a small difference, but it's not necessarily the way one ought to breathe. Now, the one caveat I will add there is that what I'm talking about here is either those paper surgical masks or the cloth masks that are either 1 or 2 layers thick. There were a group of emergency room doctors at the very, very beginning of the pandemic. I believe it was at Mount Sinai in New York City, where they were wearing a paper surgical mask and then an N95 on top of it. Or the other way around, maybe it was N95 and then a paper surgical mask on top of it. And they actually did a study on themselves where they sent their own blood to check for carbon dioxide levels. And there was a slight increase in carbon dioxide levels in their bloodstream after 8 hours. But that's not a typical mask nor a typical situation. No one outside of a hospital setting should be wearing an N95 mask. So that likely does not happen with just wearing a surgical paper mask.
What a great answer. Thank you very much. Also, what about, do you feel that which is better to wear, the face mask or the full plastic? You see both on the street.
Yeah.
The face covering, I guess you call it, or
yeah.
the full screen, or which do
Yeah,
you?
I've been asked this question. I've been asked this question a lot, and obviously we had to consider it when we were having people come back to our clinic because there were some people that didn't want to wear face masks for whatever reason. I think it's important to remember that when you wear a face mask, you are protecting yourself to a small degree because respiratory droplets that land on your face mask won't get in. And you're less likely to touch your nose if you have a face mask covering your nose. However, what it doesn't do is protect you against things coming into your eyes, and there are some ACE2 receptors, the receptor that COVID lands on in your eyes. And number 2, and more importantly, I think, is it doesn't source control, which means that your respiratory droplets aren't being protected when you have a face mask alone. The flow of respiratory droplets is very easy around the face mask. Sure, the face shield, I should say. The face shield does protect your eyes and your mouth to some degree, but it source control your own respiratory droplets to others. So when two people in a room are wearing a face mask, they're protecting themselves, or at least their nose and mouth, but they're also protecting each other. So they're not equivalent. One is not an alternative to another. Our frontline caregivers are asked to wear both, the face shield to protect their eyes, but also a face mask to protect their mouth and to protect them from spreading respiratory droplets to others.
Great, thank you. We have one last, I think we have one or two, a few questions here. So we have 5 minutes left, so we're going to try to bang through these other questions and see how we do. So with increased talk about people returning to their offices, what can corporations and their employees do to ensure a safe 9-to-5 working environment?
Yeah, I think that's a great question, and one that we're all going to have to face, because whether it's 20%, 30%, 40%, 60%, 80%, or 100% of us coming back, where eventually some of us are going to be coming back to work and not working remotely. So I think for starters, you need to have a group of leaders in your organization that support the return and support the needs for a safe return. So it's got to come straight from the top in our organization. Mike entrusted myself and our head of the patient experience and operations to work with everyone to create that environment. So I think, first of all, you have to have buy-in from senior leadership. The second thing I think you need to do is you need to remember that people are going to be not just in your office, but in other places when they return to work. So you have to have a mechanism to screen properly, both actively by asking questions about whether they have symptoms, whether they've been exposed, et cetera, whether they've traveled in the last 14 days, but also passively to have signs in the office that say, if you have symptoms, if you've been exposed, if you've traveled, reminders. People forget sometimes. So active and passive screening to come back. I think you need to have a strategy for cleaning the workspace. So if you have, hoteling offices is a big thing nowadays. You don't have an assigned office necessarily. So if you're hoteling offices, you have to have a mechanism for properly cleaning the workspace that someone's used, that someone else may use later in the day or the next day. And you have to have a group of people that is monitoring what's going on in the community, the number of cases. And if there is someone who develops symptoms that is being tested or tests positive, you have to have a way of helping that person and supporting them, but also contact tracing the people that they've spent time with in the workplace and managing that appropriately. So it's a bit of work, but it is doable. We're doing it. As you mentioned, Dr. CJ, I'm the Chief Medical Director for RBC. I've been helping them with their reentry all over the world. And many other corporations are starting to have a return to work strategy.
So our last question, and this is a tough one. We'll finish with a bang here, Dr. K. My question is, how long after being exposed to the virus will you test positive?
Oh, that's not hard.
That's easy. I understand the incubation period is 5 days, but will testing show positive sooner?
Well, I wish I had an hour to talk about this, but because it's really interesting to me, and there's a lot of data to present. But in a nutshell, because we only have a couple minutes, the testing that this person is probably referring to is the nucleic acid testing or the nasal swab, where they test for the presence of the genetic material of the virus called RNA. So you're testing for RNA, you're amplifying it, and you're trying to see if the RNA from this virus is there. There is a period when you first are exposed that there's not enough copies of the virus, even though the virus replicates very efficiently. There is a chance that there may not be enough copies to detect very early on after exposure. But typically, about 3 days after exposure, everyone's going to test positive. About 5 days after exposure, everyone's going to have symptoms.
Symptoms.
Now, how long will that positivity last? That's a really good question. And it's the basis of some people saying, don't test people over and over and over, because you may be picking up pieces of dead virus, and the dead virus is RNA or genetic material, which would yield a positive nucleic acid or a nasal swab test. But it doesn't really mean that they have it or are infectious anymore. Most jurisdictions are now saying that 14 days after the onset of your symptoms, you're cleared, as long as you're not having symptoms anymore. And we've had examples of nurses that were exposed, and then 5 weeks later, they're still testing positive, or 3 months later, they're still testing positive. They don't have the virus. They don't have viable, livable virus. They just have bits and pieces of the nucleic acid, the RNA of the virus that are still being detected. Great
So
question.
remember, to the participants, 14 days after symptoms, you should be clear after that. I've listed the travel sites. I've listed that asymptomatic spread article in the New York Times. It's really a good read, and you'll get that in the emails. This is our contact information. And I have a big shout out and thank you to the one and only Dr. Khalil Sivjee.
Thank you for the
Very
invitation.
appreciative for you being on. And thank you to all of you. I think we may have one more show left in August. So if you have any topics that you would like discussed, send them in and we'll do a show on it. Great. Thank you very much. Goodbye, everyone.
Bye-bye.